Can I start?
Please go ahead.
Okay. Good morning. Hello, I'm Elizabeth Kwaovi, and welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can choose the language you would like to hear from the press conference by turning to the globe on the bottom right of your screen and select your language. Bonjour, je m'appelle Elisabeth Kwaovi, bienvenue à cette conférence de presse de l'OMS Afrique qui se tient en collaboration avec le groupe APO. Quelques questions administratives et d'attendance. Vous pouvez choisir la langue de votre choix en cliquant sur le globe qui se trouve en bas à droite de votre écran. Joining us from Brazzaville, Congo, is Dr. Matshidiso Moeti. Good morning, Dr. Moeti, WHO Regional Director for Africa. And without too much ado, I would like now to let Dr. Moeti introduce our other panelists. Dr. Moeti, you have the floor.
Thank you very much, Madam Kwavi, and good morning and good afternoon to the journalists joining us and to everyone watching online. Bonjour, bon dia, for this press conference on the continuing COVID-19 resurgence and treatment capacities in African countries. I'm very pleased to be joined for this conversation by the Honorable Dr. Jean-Jacques Mbungani Mbanda, who is the Minister of Public Health, Hygiene and Prevention of the Democratic Republic of the Congo. Bonjour et bienvenue, Monsieur le Ministre. I'm also very happy to be joined by Dr. Ishmael Kachitae, who is a physician specialist at the Ministry of Health and Social Services in Namibia. A warm welcome to you, and thank you both very much for joining us. Africa's third wave continues its destructive pathway, pushing past yet another grim milestone as the continent's case count tops 6 million. Over the past month, Africa recorded an additional 1 million cases. This is the shortest time it's taken so far to add 1 million cases. Comparatively, it took around 3 months to move from 4 million to 5 million cases. This COVID-19 resurgence is the fastest the continent has seen. New cases have increased for the 8th consecutive week, and 18 African countries are now in resurgence. The Delta variant, which is currently the most transmissible of all the variants, has been detected in 21 countries in Africa. There is a consistent upward trend in 12 countries with sharp increases in some, such as Algeria, Malawi, Senegal, and Zimbabwe. And although we're starting to see a decline in some countries, such as the Democratic Republic of the Congo, Eritrea, Kenya, and Namibia, case numbers remain relatively high. As this surge sweeps across Africa, we're witnessing the brutal cost in lives lost. Deaths have climbed steeply for the past 5 weeks, jumping 40% in the past week. This is a clear warning. Our hospitals are at a breaking point. In all, 153,000 people have sadly died. Africa is now just 1% shy of the peak in fatalities reached in January. Under-resourced health systems are facing dire shortages of health workers, supplies, equipment, and infrastructure needed to provide care to severely ill COVID-19 patients. Health systems that were already struggling to provide essential services to communities prior to the pandemic are now buckling under the pressure of COVID-19. We've seen hospital admissions in around 10 countries increase rapidly, and at least 5 countries, including South Africa, Namibia, and Zambia, are facing shortages of ICU beds. A rapid WHO assessment of 6 countries facing a resurgence found just a third of the medical oxygen needed is produced. The number one priority for African countries is boosting oxygen production so we can give critically ill patients a fighting chance. Effective treatment is the last line of defense against COVID-19, and it must not crumble. As WHO, we're working with countries to improve treatment and critical care capacities. In a WHO survey to which 30 African countries responded, only 18 had included corticosteroids in their national treatment guidelines as recommended by WHO. 9 countries are including medications that are not recommended in treating COVID-19, such as hydroxychloroquine and lopinavir. So far, we are providing guidance to update these protocols in line with the available evidence and to train health workers in COVID-19 case management. We're also delivering essential medical supplies such as oxygen cylinders and have supported the manufacture and repair of oxygen production plants. To free up bed space, we're working with health facilities in South Africa, for example, to reduce admissions for non-acute cases, and in Sierra Leone, to update patient discharge criteria. In Uganda, we've procured more than 300 oxygen regulators, which has eased the pressure on intensive care units and increased the number of beds available. We're also deploying emergency medical teams to countries seeking additional support. Last week, WHO recommended the use of monoclonal antibodies in the treatment of severe COVID-19 cases. But for now, this life-saving therapy is largely out of reach for African populations at a cost of around $2,000 per patient. So we are advocating for generics to be produced rapidly to make these products more affordable. The pace of COVID-19 vaccine rollout is stagnating at around 3 million doses a week. So far, 53 million doses have been administered and 18 million Africans are now fully vaccinated. This clearly needs to urgently increase, and we are counting on dose sharing arrangements to protect more people from falling severely ill or dying due to COVID-19. We expect the imminent delivery of doses from the United States and some countries in Europe through COVAX, and for COVAX supplies to start gathering speed in the latter part of this third quarter. Countries such as Ethiopia, South Africa, and Eswatini are also dealing with crises that are limiting capacity to implement response interventions with the risk of undetected transmission of COVID-19. So we encourage everyone, everywhere, to adhere to preventive measures of masking, hand hygiene, and physical distancing to stop the spread of this virus. So I look forward very much to our conversation today with the Honorable Minister and our guest from Namibia, and I thank you once again for having joined us.
Thank you very much, Dr. Thank you very much, Dr. Moeti. Honorable Dr. Jean-Jacques Mungani Mbanda, bonjour. Est-ce que vous pouvez nous parler de la façon dont la République démocratique du Congo s'attaque à l'augmentation des cas de Covid et nous parler un tout petit peu de vos préoccupations en la matière? Merci.
Merci beaucoup. Madame la directrice de la région Afro de l'OMS, distingués invités à vos titres et qualités respectifs, chers journalistes, depuis le 13 mai 2021, la République démocratique du Congo fait face à la 3e vague de la pandémie COVID-19. En effet, au 11 juillet 2021, soit au cours de la semaine épidémiologique 27, le nombre cumulé de cas signalés en RDC s'élève à 44 334 cas positifs, dont 984 décès, soit un taux de létalité de 2,2%. Toutes les 26 provinces de la RDC ont dès lors notifié chacune au moins un cas de COVID-19, même si 12 provinces, en majorité frontalières, demeurent actives. À ce jour, Kinshasa reste l'épicentre de l'épidémie, avec 71,5% des cas déclarés sur l'étendue du territoire national. Après Kinshasa, on note le Nord Kivu, qui est placé en seconde place avec 8,2%, et le Congo central qui prend la 3e place. Il est judicieux de signaler qu'au cours de cette 3e vague, on est passé de 448 cas à la 21e semaine à 2606 cas à la 25e semaine, soit une hausse impressionnante de 481,7% en 5 semaines. Le pic de la vague actuelle a dépassé celui des premières et deuxièmes vagues. Fort heureusement, durant la 27e semaine, la RDC commence à enregistrer une baisse générale de l'incidence COVID-19 de 14,9% par rapport à la 26e semaine. Il y a actuellement 14 719 cas actifs dans le pays, ce qui reflète une diminution des cas actifs au cours des dernières 24 heures. Au terme de la 27e semaine, les données disponibles sont 1513 nouveaux cas confirmés ont été rapportés à travers le pays, dont 21,7% étaient hospitalisés, avec un peu plus de la moitié sur la ville-province de Kinshasa. Parmi les patients hospitalisés, 32,9%, donc 108, étaient sous oxygène dans un état sévère critique, majoritairement à Kinshasa. Aussi, on compte 151 patients avaient au moins une comorbidité et ou une co-infection, hypertension artérielle, diabète ou baisse d'immunité, dont 110 cas à Kinshasa. De plus, au cours de cette semaine, plus de 14 000 patients étaient suivis à domicile par les équipes de la prise en charge médicale. Depuis le lancement officiel de la vaccination contre la COVID-19 en RDC, le 19 avril 2021, sur un total de 498 sites de vaccination prévus, il y a 343 qui sont opérationnels et sont répartis dans 12 provinces. Au 11 juillet 2021, selon les informations disponibles, 72 748 personnes ont reçu la première dose du vaccin AstraZeneca et 1619 la deuxième dose du vaccin. Madame la directrice de la région Afro de l'OMS, chers journalistes, distingués invités à vos titres et qualités respectifs, désormais, le profil évolutif de cette maladie semble se dessiner plus clairement. En RDC, le déclenchement de cette troisième vague survient non seulement à la suite de la levée des mesures de restriction, à la fin de la deuxième vague, au relâchement de l'application de gestes barrières, mais surtout par la réintroduction et la circulation concomitante de plusieurs variants du virus, notamment le variant Delta. En effet, selon le rapport du séquençage réalisé sur les échantillons de la surveillance au laboratoire INRB, durant les 2 dernières semaines, soit du 21 juin au 11 juillet 2021, le variant Delta représente environ 74% dans les échantillons prélevés dans toutes les 3 provinces les plus affectées du pays. De ce qui précède, Son Excellence, Monsieur le Président de la République, chef de l'État, et Son Excellence, Monsieur le Premier ministre, coordonnateur du secrétariat technique du comité multisectoriel de riposte à la COVID-19, ont énoncé un train de mesures visant à limiter la propagation du virus. Madame la directrice de la région Afro de l'OMS, chers journalistes, distingués invités à vos titres et qualités respectifs, la République démocratique du Congo compte poursuivre les efforts pour réduire l'impact sanitaire et socio-économique de cette maladie sur nos populations. Le grand défi pour cette troisième vague et le futur proche demeure l'acceptation de la vaccination par la population. C'est pourquoi, avec l'aide de nos partenaires, les actions du gouvernement resteront focalisées non seulement à améliorer les résultats des principales interventions de la riposte, mais surtout de mettre l'accent dans la communication et la sensibilisation pour une forte adhésion et extension de la couverture vaccinale au profit des populations les plus à risque. Il est important que l'OMS, Gavi et UNICEF, ainsi que d'autres partenaires, appuie le gouvernement à obtenir davantage de vaccins maintenant que la demande commence à augmenter. Je demeure persuadé et convaincu que seule la vaccination devrait nous permettre de réduire les prochains mois l'ampleur de cette pandémie ainsi que le taux d'hospitalisation et de décès liés à cette maladie. Je vous remercie.
Et nous qui vous remercions, Dr Mungani Mbanda. Dr Ishmael Kachitae, please, can you give us an overview of case management situation in Namibia? Dr. Ishmael, yes, Ishmael, can you hear me? You are on mute.
Good morning, Madam Chair. I can hear you now. I can actually start. Can I go ahead?
Yes, please. Yes, please.
Okay. Regional Director of WHO African Region, Dr. Mweti. Minister of Public Health, Hygiene and Prevention for the Democratic Republic of Congo, Honorable Dr. Mungani Mbanda. Distinguished ladies and gentlemen of the press. I consider it a great honor to be part of this panel, and I wish to express the gratitude of the Ministry of Health and Social Services and the case management pillar of the national COVID-19 response in Namibia. Namibia, like a number of countries in the region, has experienced a resurgence of cases of COVID-19, and currently the country is in the third wave, with the current peak recorded in June 2021. 4 times that of the second wave in December 2020, and 8 times that of the first wave in August 2020. As at the 12th July 2021, the country has recorded a total of over 108,785 COVID-19 confirmed cases and 2,240 deaths, which translate to a case fatality rate of 2%. Of the confirmed cases, 3,731 are healthcare workers, accounting for 4% of the total cases. The spike in the cases has resulted in over 500 hospitalized confirmed cases, with 20% in the intensive care units. Over 50% of the hospitalized cases are in Windhoek, the capital city of Namibia, which has the highest level of critical care expertise and serves as the main referral hub for most regions in the country. This has resulted in a very high bed occupancy rates beyond the capacity of the healthcare systems to cope. There's been an associated spike in the deaths, with approximately 1,000 deaths in the last month. The deaths are associated with the following factors: the emergence of the Delta virus in Namibia, which with high numbers of infections over a short period, resulting in a high number of severe and critical ill patients. A high prevalence of comorbidities in some communities, limited capacity in some districts and regions to manage severe and critical cases, and a strong misinformation lobby resulting in non-compliance to public health measures, underutilizing of available healthcare services, and delayed complicated presentations to our health facilities. As mentioned earlier,
ils m'ont pas écouté là.
Si, on a écouté, mais sauf pour dire que
Monsieur le ministre, est-ce que vous voulez bien couper votre micro? Dr. Ishmael, you can go on. Dr. Ishmael, Dr. Kachitai, we have lost Dr. Kachitai.
Perhaps let's move on to questions, and then maybe the doctor can come back.
All right. So now that we have almost heard all our panelists, let's turn to the press to ask questions. To do this, Please use the question and answer function that you will find on the Zoom application. Please remember that you will also need to provide a name and the news organization you represent to have your question asked. We have also with us a certain number of experts: Dr. Tierno Balde, Program Manager, Deputy Incident Manager. We have Dr. Richard Mihigo, Coordinator, Immunization and Vaccine Development Program, Dr. Nixie Gumede Moletsi, Regional Virologist, and also with us, Dr. John Apia Adabie, Sub-Pillar Lead for Case Management. So let's start with the first question of the press. Daniel, are you on the call?
Yes.
Yes, please go ahead.
Okay, can you hear me?
Yes, and kindly also tell us who you're addressing your question to and the media you represent. Thank you.
All right, thank you very much. My name is Daniel Arab Moi from China Global Television Network Africa Bureau based in Nairobi. I'm directing my question to Dr. Moeti. Fortunately, you've answered my question that I'd sent earlier, but allow me to ask a slightly different question, but still under the same topic. Dr. Moeti, what do you have to say about countries like Rwanda that initially did very well, to contain COVID-19, but now we are seeing these countries struggling, especially Rwanda. We are seeing Rwanda going back to a 10-day lockdown. What could have gone wrong to countries like Rwanda? And what can you advise these countries in terms of handling the third wave of COVID-19? Thank you very much, Doctor.
Okay, thank you very much. I think that's a very good question for many countries indeed, because we have seen countries go through a wave. Countries start off very well with very comprehensive, strict measures, and then start to relax these measures, and also some sort of fatigue on the part of the population start to take shape. That has happened in many countries, and it probably has happened in Rwanda. We are always seeing an attempt to balance between the need to control the pandemic and the need to enable many activities of daily life to continue. Economic activities, very importantly in countries, education for children, and so forth. It is a permanent balancing act between locking down, controlling movement of people, and allowing normal life, especially economic activities, because we know that there's going to be such a severe negative economic impact in African countries. So it is partly that. And after a year and a half, in many communities, people have simply become wary of this abnormal way of daily life, wearing masks, keeping distances, and also being able to sustain some of the measures in terms of hygiene practices to minimize the transmission of the virus. And then thirdly, of course, we have variants. We have particularly the Delta variant, which is rather more transmissible than some of the other variants that are circulating around. And that means it can spread much more quickly from one person to a number of people much more extensively. And this is part of what's happened. So we have consistently, and governments are constantly having to decide to restrict movement, gatherings, some of the normal activities again, and see that the wave, the number of cases goes down, and then restart normal life again. It's going to be like that until we achieve very significant levels of coverage with the vaccines, which also, by the way, will contribute to minimizing the emergence of variants. That's why being able to acquire and provide the vaccines to populations is so important.
Thank you, Doctor.
Thank you, Dr. Moeti. I can see that Dr. Ismail is back. Would you like to finish your statement? Please, you have the floor.
I don't know exactly which part did you not get, but nevertheless, I will come closer to the end As mentioned earlier, just as other countries that have experienced resurgence in COVID-19 cases due to the Delta variant, Namibia's health care system has been overwhelmed during the current third wave. Some of the challenges and gaps are shortage of oxygen, human resource shortages worsened by the increased infections among healthcare workers, limited medical equipment such as ventilators, monitoring devices to manage high numbers of critically ill patients. The government of the Republic of Namibia is taking a number of actions to address these challenges, such as the expansion of healthcare facilities to surge the bed capacity and to manage cases of COVID-19, training of doctors and nurses in critical care, mobilizing healthcare workers from the private sector and abroad to surge capacity for case management and increasing oxygen supply capacities at health facilities. The government of Namibia appreciates the continued support of WHO and the other partners in strengthening the case management response through technical guidance, capacity building, and procurement of medical equipment and supplies. We'll continue to count on your support as the country works hard to overcome the pandemic. Thank you very much. Can you hear me? Did you hear me? So they don't know. It's on, yeah.
Yes,
Could you hear me?
heard you very well.
Yes, yes,
Okay.
thank you very much. Thank you.
Thank you.
Thank you very much, Dr. Kachitai. I would like to call now Paul. Paul, are you on the
Yes, yes, I'm here. Can I go ahead with my question?
Yes, please.
Yeah, thank you very much. My question goes to Dr. Moeti. This Sunday marks the 100th year anniversary of the administration of the first dose of the BCG vaccine. And with TB still the leading cause of death among persons with HIV and no new vaccine for 100 years, in sharp contrast to the COVID-19 pandemic. What do you think the impact of COVID-19 pandemic on WHO and partners' approach to TB control program will be going forward? I'd also like your comment on the findings of a new WHO study that identified HIV as a major risk factor for COVID-19. What does this translate to in Africa, where a number of countries are dealing with HIV and COVID-19 at the same time? Thank you very much.
Okay, thank you very much. Indeed, well, it is indeed an important anniversary for such an old disease that has wreaked havoc throughout the world through the ages, and still is a public health problem in Africa, very much linked to and complicated by the high incidence and prevalence of HIV in African countries, that we continue to have such a significant problem of tuberculosis and the emergence of drug-resistant forms of the bacterium, which complicates treatment. That's part of the big problem that we have now, multi-drug resistant tuberculosis. I mean, in a way, it's a bit ironic. That's a very interesting question, which I've never had to think about, that there's been a vaccine for this disease over many years, and we still struggle with the emergence of this disease as it has linked itself to something else. Whereas for COVID-19, there has been a very intense global push and work together between governments, financing, the private sector, and multilateral organizations to rapidly, in the most rapid vaccine production possible, produce vaccines and to deploy them worldwide in such a manner. It does make you think, okay, now tuberculosis, of course, exists not as a problem, not only in Africa, but also in other countries, but it is largely a forgotten problem in many of the wealthier countries. So is the difficulty in terms of motivation for investment. It's perhaps a disease for which not much of a market exists in terms of investment and reaping the benefits of investing in producing tools. I think it makes us think very hard about the question of equity and what can be done in order to work together globally to invest in some of the problems which are no longer a worldwide problem, but which continue to be a significant problem for some of the regions, particularly for lower income regions and for our region in Africa. So again, this calls for solidarity, it calls for partnership, and it calls for a concern about equity in investing in improving the tools that will continue to deal with diseases like tuberculosis. And it also calls, very importantly, on investment in healthcare systems so that the tools that are available, the medicines that are available to treat tuberculosis can be availed and used effectively in health systems in our region, frankly, which continue to be very weak. So it calls for investment by everybody, by the African governments themselves, by the international community, international solidarity, and then effective tools and analysis by ourselves and others in public health in WHO to continue to find solutions to such intractable problems that have been going on for centuries, like tuberculosis. HIV, I think, is a risk for severe disease among people, particularly who are immune suppressed because they may not be on treatment. So it means in African countries, it's very important that we don't allow the focus on COVID-19, for example, to slow down access to treatment for HIV. We need to be continuing to provide these services at the same time. And we need to be very aware when we are defining vulnerable groups who need to be prioritized for vaccination, for example, to be aware that even if in most cases these are younger people, not the elderly, in Africa we have to pay particular attention to people who have HIV and start with making sure that they are getting their treatment, and then we are aware of the possibilities that they may get severe forms of the illness and deal with that.
Thank you very much, Dr. Moeti. Monsieur le ministre, je me tourne vers vous. Je voudrais savoir, c'est une question que se posent les journalistes, combien de doses de vaccins ont été détruites juste ici en RDC et si vous avez cette information dans les pays africains? Et quelle pourrait être la raison pour laquelle ces doses de vaccins n'ont pas pu être utilisées avant qu'elles n'arrivent à expiration, Monsieur le ministre? Donc, combien de doses ont été faites et pourquoi est-ce qu'on ne les a pas utilisées avant leur date d'expiration?
Merci beaucoup. En fait, le 2 mars de cette année, la RDC a bénéficié dans le cadre de la facilité COVAX de 1 716 000 doses. Mais du fait du retard du début de la vaccination, lié aussi à une hésitation au niveau mondial quant au vaccin que nous avons reçu, il s'agit du vaccin AstraZeneca, nous avons commencé que le 19 avril à vacciner. À ce jour, nous avons vacciné autour de 72 000 personnes. Mais rapidement, comme c'est des lots qui périmaient le 24 juin pour une grande partie, le 27 juin pour une deuxième partie et au 11 juillet, nous avons décidé rapidement, comme vous le savez, nous avons redéployé 1 300 000 doses dans 6 pays voisins parce que ces pays étaient en avance de vaccination par rapport à notre pays, ce qui a permis à ces pays d'aller vers leur deuxième dose et nous sommes restés avec la différence de 1 700 000 doses moins 1 300 000 doses. Nous avons mis ce vaccin hors circuit parce que non utilisé et en voie de destruction. Donc, à ce jour, nous sommes en pénurie de doses de vaccination et dans le cadre de plusieurs accords de la facilité COVAX, l'Union africaine et des attentes bilatérales, nous espérons avoir des doses de vaccin d'ici la fin de ce mois. Nous sommes aussi dans une négociation directe avec la MONUSCO qui va nous donner pour compléter les deuxièmes doses de certaines personnes au courant des jours qui vont arriver. Nous bénéficierons de 8 000 doses de la part de la MONUSCO. Donc, voilà la situation actuelle par rapport aux doses qui sont périmées, qui sont mises hors circuit, en voie de destruction et en attente des doses pour compléter le cycle vaccinal des personnes qui ont accédé lors de la vaccination, lorsqu'on a commencé la vaccination le 19 avril de cette année.
Merci. Docteur Migo, est-ce que vous pourriez éventuellement compléter la question concernant le nombre de doses, le volume de doses qui ont été détruites dans la région africaine de l'OMS?
Oui, absolument. Merci beaucoup, Madame Kouavi. Effectivement, nous avons environ 450 000 doses qui ont déjà été expirées dans 8 pays environ dans la région africaine. Son Excellence, Monsieur le ministre, vient de parler de la situation de la RDC, mais nous avons également eu des situations dans les pays où, malheureusement, certains de ces doses, et surtout le vaccin AstraZeneca, qui sont arrivés avec de délais d'expiration extrêmement courts qui n'ont pas permis à ces vaccins d'être déployés de manière efficiente dans tout le reste des pays. Donc, c'est une situation, c'est vrai, que nous déplorons, mais au niveau de l'OMS, nous travaillons étroitement avec les pays pour essayer de minimiser dans la mesure du possible la perte de ces vaccins et appuyer les pays pour l'utilisation de ces doses dans les délais maximums. La bonne nouvelle, c'est que cette tendance à l'expiration des doses est en train de diminuer et nous avons la plupart des doses qui ont une durée d'expiration courte sont immédiatement utilisées à travers le pays. Donc, nous espérons que c'est une tendance que nous n'allons plus voir dans les semaines à venir. Merci.
Merci, Dr. Minigo. Dr. Moeti, I have a question from Marcus at Q&A. South Africa has experienced severe riots and looting over the past week. How concerned are you that this kind of political unrest might fuel the third wave in some parts of Africa?
Yes, thank you for that question. Indeed, we're very concerned that the last 3 or so days of rioting in some parts of South Africa, in several provinces of South Africa, may exacerbate the situation of a very severe wave already. We were starting to see a kind of leveling off of cases, daily cases in South Africa. But of course, these kind of activities, one, have meant that people are gathering in these places where these events are happening. There is interaction among people in close crowds with those who are trying to control the movement of people and their activities in looting and so on and so forth. So there may be transmission, may be increased in these circumstances. And then, of course, this type of activity has meant that moving people around has been very limited. There have been needs to control the movement of people. It will have had a negative impact on prevention interventions and a negative impact on the vaccination program. We are aware, certainly, that in KwaZulu-Natal, there has been a steep decrease in the number of people that have been attending vaccination sites in the past few days. So it is indeed a very sad and unfortunate situation. And I think the government has to brace itself, and we in WHO will be preparing to see an increase in the cases again, and to support whatever the government may need to do to bring the situation of the third wave under control.
Thank you, Dr. Moeti. Dr. Kachita, I'm turning to you. This is a question from One Africa TV. Doctor, Namibia has purchased vaccines that were supposed to have arrived in the country this week. Why, if they have not, why is this, well, why do we, how can we can explain this delay in the reception of vaccines? And it seems like the state hospitals have also run out of crucial medication like Lexan to test, to treat blood clots in COVID-19 patients. And has this been looked into, and what is the government doing about it?
Thank you for the question. Yes, there was a delay in receiving the vaccine that has been ordered for Namibia, but the delay is mainly caused by the scarcity of the COVID-19 doses vaccines in general in the global market due to the increased demand. We are expecting 250,000 doses of the Sinopharm, which are going to be delivered tomorrow. Next week, another delivery of 40,000 doses of AstraZeneca will also be delivered, which is actually next week. And then also during the month of August this year, we are expecting the delivery of over 300,000 doses of Johnson & Johnson vaccine procured by the government of Namibia at African Union via Afriva Vaccine Acquisition Trust. We are also expecting Johnson & Johnson vaccines from the US government. Okay, coming back to your to the other question as to whether there is actually any delay in some essential medication, such as, for instance, I mean the anticoagulants in the form of Clexane, if I can put it that way. There has been, we are aware of that. We've run out of that for a short period of around about 1 week, but there has been purchase orders being placed with suppliers to procure and purchase these medicines. The stock will be delivered soon. Obviously, what the WHO African regional director has actually said, Dr. Mweti, is also affecting us, looking at the situation of the current riots now in South Africa, because Namibia is actually receiving a lot of their items, medicinal items from South Africa. So that will actually affect us in a way, but we are working on that. We have been having intense consultations with our minister and also our Minister of Foreign Affairs. We are working on trying to find solutions. Maybe you will also be contacted to find a way of actually supporting us to overcome these challenges so that we can actually directly import our stuff through our HEBA, which is actually Walvis Bay, instead of actually getting it through South Africa. Thank you.
Thank you very much, Dr. Kachitai. I will now turn to Dr. Mihigo. This is a question from Bloomberg, from Klaus William with Bloomberg. Dr. Mihigo, is the WHO concerned about the latest Johnson & Johnson revelations that the vaccines can cause a rare nerve disorder known as Guillain-Barré?
Yeah, thank you, Madam Koavi. Yeah, we have, of course, following very carefully the pharmacovigilance system for these new vaccines as they get rolled out quite largely. It's very important to note that during clinical trial, it's literally impossible to identify all the potential side effects that can happen. And in this case, for the Janssen vaccine, indeed, we have heard that those very, very rare events that have occurred, we are following that very closely. And as we have seen for the the AstraZeneca vaccine, it's very important here to mention that when you are immunizing many people, we are really looking at what are the benefits, risk for this vaccine. And so far, I think the benefit has by far outweighed the risk for these very rare events. So this is a situation that we are following quite closely, and we are heightening our pharmacovigilance system, particularly that we are expecting, as we have heard from the honorable delegate from Namibia, a big arrival of the Janssen vaccine in the region. So we are heightening our pharmacovigilance system to make sure that country can be supported adequately. Thank you.
Thank you very much, Dr. Mihigo. I have a question from Sarah. Sarah, are you on the call?
Yes, thank you so much. Dr. Mihigo, you mentioned that 450,000 expired doses have been destroyed in total across the continent. Can you please name the specific countries where this occurred? Thank you.
Well, I think what is more important, it's as I explained, I think we are definitely closely monitoring, and the message really we would like to convey here these vaccines were not necessarily wasted. It's, I think these are the vaccines that arrived with some of very short expiry dates, which was very difficult to deploy immediately. And at the end of the day, they expired. So I think there is no country that has really tried to lose vaccine for the sake of things. I think we need to really pass this message very clearly that we are seeing an extraordinary effort that is being done by all the countries to deploy the vaccine. But despite that, as I said, we have had around 450,000 doses that have expired in several countries, 8 in general. So Malawi, we have heard at the beginning of that. We have some doses that also were expired in South Sudan, Liberia, Mauritania, Gambia, Sierra Leone, Guinea, Comoros, and few doses in DRC. But I think what is more important again is the current step that countries have taken really to maximize the use of these life-saving tools. Thank you.
Thank you very much, Dr. Minigo. Monsieur le ministre, je me tourne vers vous. J'ai une question de Marthe Bozwandole de l'agence France Presse à Kinshasa. La question est la suivante. Chaque semaine, la situation en Afrique est de plus en plus alarmante. Aujourd'hui, nous parlons de l'augmentation de décès qui ont dépassé les 40% dans certaines régions d'Afrique par rapport à la semaine dernière. En attendant que les vaccins soient déployés partout, que les campagnes de vaccination prennent de l'ampleur, est-ce que vous conseilleriez aux responsables politiques de confiner ou de reconfiner les agglomérations où le virus circule le plus, Monsieur le ministre? Et Dr Moeti, si Dr Moeti veut également prendre la parole sur cette question. Oh, Dr Moeti, would you like to answer this question?
Yes. Oui, je vais répondre à cette question. Bon, je vais essayer en français d'abord. Bon, c'est vrai que à chaque situation, il est important de voir comment réagir pour avoir un impact efficace. Parfois, il est possible de renforcer les mesures de santé publique en ce qui concerne, comme on dit, la mobilisation de la population, le passage des messages, appuyer les personnes, les ménages à avoir accès à tous les utiles pour se protéger, y compris le masque, l'eau et le sanitizers, et à garder les distances. Mais parfois, si la situation est si intense, il est nécessaire d'aller vers des mesures de confinement, comme nous les appelons. C'est ce que le gouvernement de l'Afrique du Sud a dû faire. Ils ont renforcé, comme on dit, la minimisation des mouvements, des regroupements de personnes. Ça dépend de la situation et des données. Et parfois, il est important. Ce que nous disons, c'est qu'il est mieux que ces données soient utilisées pour mettre sur place ces mesures de façon localisée. Ça veut dire qu'il est très difficile de confiner tout le pays. Il faut voir là où la circulation du virus est très intense. Et de temps en temps, il est important de le faire, juste d'avoir le temps de renforcer les mesures de la santé publique au niveau individuel et aussi, dans le cas maintenant, de renforcer la capacité de la prise en charge efficace pour minimiser les décès de personnes. Donc, parfois, il est nécessaire de conseiller le pays à faire comme ça.
Thank you very much, Dr. Moeti. Merci beaucoup. The next question goes to Dr. Gumede Nixie. Nixie, are we making headway in suppressing new COVID-19 variants, and any hope that they will be vanquished in the near future? And while you answer to this question, can you also tell us if give us shed light on the vaccine rollout so far. What are the progress? What are the hiccups? And this question, maybe Richard can help answer this question at all. But first of all, about the variants, please, Nixie.
Okay, thank you, Madam Chair. I think I just want to echo what the panelists, and including the Honorable Minister, they've mentioned earlier on related to the vaccination that is so much required or needed to be able to curb the spread of this disease. And then in addition to that, we know that once you use a very effective vaccine, this evidence has been very much obvious to the previous diseases for that matter, that the very effective vaccine is able to control, to eliminate, as well as eradicate any disease that is of a problem for that matter. So we've got quite a very high hope that with the rollout of the vaccines in all the countries, there'll be a way that each and every country or globally will be able to control the spread of the coronavirus. And then in addition to that, and that has been mentioned also with the panelists here, is that the countries are still repeatedly reminded that they need to comply to the safety measures or social measures for that matter, continuously wearing masks, washing hands, as well as, of course, keeping a very good social distance, while we are still making sure that each and every country is getting as much doses as possible and the number of people are getting vaccinated, so that we are able to build a herd immunity, and as such we'll be able to protect our people, our community at large. Over to you.
Thank you very much, Nixie. Monsieur le ministre, je me tourne de nouveau vers vous. Nous avons une question de ARP Congo. Monsieur le ministre, nous constatons que le taux de mortalité grimpe sensiblement au Nord Kivu, en RDC, cette année 2021 par rapport à l'année dernière. Est-ce que vous pouvez confirmer avec certitude que la cause de cette hausse serait la troisième vague de COVID-19? Votre micro est coupé, voilà. Merci.
Oui, merci. Non, merci beaucoup pour la question. Effectivement, depuis le 22 mai de cette année, nous avons connu l'éruption volcanique à Goma avec une forte circulation des personnes, d'abord qui se sont déplacées pour fuir le volcan, et puis le retour, et puis le campement dans des camps. Tout ça a diminué fortement les mesures, d'abord qu'ils étaient difficiles à respecter, et nous avons, comme dit dans le propos lorsque je me suis exprimé, après Kinshasa, le Nord Kivu, le Congo central, donc le Nord Kivu actuellement accuse de cas élevés de cas COVID-19 et également des complications et des décès. Ça, je puis le confirmer. Mais la tendance globale, comme je l'ai dit, nous avons connu une hausse forte du fait de la troisième vague qui aujourd'hui, pour tous les séquençages qui ont été faits les 2 dernières semaines, montrent que 74%, lorsqu'on fait les séquençages, ça détermine le variant Delta. Donc, nous prenons ça à mesure et nous sommes assez satisfaits parce que depuis la 27e semaine, le nombre de cas au niveau national et décès diminue. Nous retenons tout ça et nous prenons ça en considération. Je vous remercie.
Merci pour votre réponse, Monsieur le Ministre. Richard, I actually asked the question earlier on, but maybe you can shed some light on vaccine rollout so far. What are the progress, the hiccups? It's a question from Zinwa about the vaccine rollout.
Okay, maybe very quickly. I know every week the regional director provide few updates on the progress that are made on the continent on the vaccine rollout. I think in a nutshell, what we can say, after literally a stop in the June where we've seen the supply arriving on the continent has literally stopped. We are now seeing, at least with the donation that has started to come in, a sort of restart of the vaccination program in many countries. Today, we have received around 70 million doses on the African continent, with close to 53 million doses that have been administered in Africa, with 18 million of people who have received the 2 doses across the countries. So this is still very low compared to what globally we have seen, where close to 3.5 billion doses have been delivered. But we do have great hope with now the announcement that the regional director announced last week, with the supply that are going to increase in Q3, not only with a more diverse portfolio of vaccines. We are going to receive a lot of new vaccines around Q3 and Q4, Johnson & Johnson, Pfizer vaccine, but also Moderna vaccine. So we will have more choice, but also more supply coming to the Africa. What we are doing now is really to help country, and country are doing a great job in that, to prepare for that massive arrival of vaccines in the 3rd and 4th quarter of the year. We will need to increase the current pace of administration of the vaccine at a minimum by 3 to 5-fold to maintain the current pace of administration. But definitely what will require is to increase the preparedness, to increase the resources, and we've seen additional announcement both through COVAX, Gavi, but also African Union of resources that are going to come. So maybe this is in a summary what I can say with regard to the rollout of vaccine in the region.
Thank you very much. Thank you very much, Dr. Amigo, for this update. We have Sui Karofi live from Ebony Today, which is a fact-checking site. Mr. Karofi, are you on the call?
Oui, je suis en ligne. Je vais poser ma question en français. J'espère que Dr. Moeti pourra me donner un élément de réponse en français. Donc, la question, c'est que depuis un certain temps, comme nous travaillons sur des questions de fact-checking, on a remarqué que les questions relatives à la version du vaccin AstraZeneca que nous avons en Côte d'Ivoire est remis en cause par les populations. Même les personnes qui étaient plutôt favorables à la vaccination ont commencé à s'inquiéter lorsque l'Union européenne a décidé de ne pas reconnaître cette version du vaccin AstraZeneca qui est largement utilisée en Afrique. Ce qui fait que les populations sont de plus en plus réticentes, donnant donc raison à toutes ces contre-informations sur les réseaux sociaux, faisant état d'un vaccin entre guillemets pourri qui a été vendu aux Africains. Ma question, c'est de savoir, depuis cette décision de l'Union européenne rendue publique, qu'est-ce qui a été fait par l'Organisation mondiale de la santé, et notamment OMS Afro, pour essayer de, je ne dirais pas pousser, mais essayer de mener une campagne pour la reconnaissance intégrale de tous les vaccins contre la COVID-19. Parce qu'aujourd'hui, nous, en tant que fact-checkers, en tant que journalistes africains, c'est de plus en plus compliqué pour nous d'expliquer aux populations le bien fondé de se faire vacciner quand les gens vous sortent chaque fois comme argument, même l'Union européenne ne reconnaît pas ce vaccin. Qu'est-ce qui a été fait ou qu'est-ce qui est en train d'être fait pour la reconnaissance de ces vaccins-là?
OK, merci pour cette question. Je peux d'abord dire que ce vaccin a été reconnu, a été donné un accord pour l'utilisation d'urgence par l'OMS. Nous avons une équipe au niveau de l'OMS, de notre siège à Genève, qui fait l'analyse de données de tous les vaccins produits et qui donne cet accord pour appuyer tous les pays du monde qui n'ont pas peut-être la capacité de faire eux-mêmes cette analyse de données, à être à l'aise pour utiliser ces vaccins. C'est la base sur laquelle nous avons comme on dit, conseiller au pays que vous pouvez utiliser ce vaccin. Donc, nous sommes en train comme l'OMS en Afrique, avec nos collègues qui sont basés à notre siège à Genève, en communication constante avec l'agence des médicaments qui est l'agence de régulation pour l'Union européenne pour faire le plaidoyer pour la reconnaissance de ces vaccins. Je dois dire que selon les procédures et les règles, ce qu'ils font, c'est analyser des données de vaccins et puis donner cet accord. En ce qui concerne le vaccin qui est produit en Inde, l'objectif n'était pas à vendre, à produire ce vaccin pour l'Europe. Ça a été commandé par le COVAX pour distribuer dans d'autres pays. Donc, le Serum Institute of India n'a pas demandé au niveau de l'Union européenne d'examiner leurs données. Donc, nous sommes en train de discuter avec eux si ça peut être possible. C'est ce qu'ils font nos collègues à Genève. Je suis en communication constante avec la directrice qui s'occupe de cette question-là. Mais dans les règles de l'Union africaine aussi, ça dépend de chaque pays à décider quelle reconnaissance d'un vaccin ils vont accepter ou pas. Donc, je crois qu'il y a le travail à faire, même par le gouvernement africain, pour faire le plaidoyer auprès des ambassadeurs de quelques pays européens où il y a l'intérêt de population d'aller voyager ou bien de diminuer cette impression parmi les populations africaines que nous sommes en train de leur donner un vaccin qui est inférieur. Je peux dire aussi que ce vaccin qui a été produit en Inde a été utilisé en Grande-Bretagne. Donc, les Britanniques font aussi face à cette difficulté pour eux. Ça concerne le voyage en Europe, dans quelques pays de l'Union africaine. Mais j'ai été informée et je peux demander à mon collègue Richard de le dire. Je crois qu'il y a un progrès. Il y a quelques pays européens qui ont décidé de reconnaître comme on dit, l'accord de l'OMS pour l'utilisation de ce vaccin. Ce que vous, comme communicateur, vous pouvez faire, c'est de rassurer, c'est d'expliquer à la population africaine que c'est le même vaccin, en fait. C'est seulement les procédures de partage de données qui ont été liées à là où cibler le vaccin qui a été produit en Inde. Ce n'est pas du tout parce que c'est un vaccin qui est inférieur. Si vous pouvez nous aider à corriger, à distribuer ces informations, et vous pouvez vous référer à nos collègues au niveau du bureau pays de l'OMS qui peut continuer à vous donner, à mettre à jour les informations disponibles concernant ce sujet. Merci.
Docteur Migo, est-ce que vous voulez compléter les propos du docteur Moïti?
Absolument. Je pense que le docteur Moïti a donné réellement la réponse globale. Si je pouvais juste ajouter que le vaccin d'AstraZeneca qui a été développé, comme on le sait, par l'Université d'Oxford et la firme AstraZeneca, a été dans son projet de commercialisation fabriqué sur plusieurs sites. Il est non seulement fabriqué en Europe, pas uniquement en Grande-Bretagne, mais dans plusieurs pays européens, mais il est également fabriqué ailleurs, aux États-Unis, en Corée du Sud, au Japon, en Inde, et c'est exactement le même produit tel que nous le connaissons en Europe ou en Inde ou aux États-Unis. La seule différence, comme on l'a entendu, c'est que l'Agence européenne de médicaments, qui est en fait l'autorité de réglementation pour les pays de l'Union européenne, n'examine que les produits, vaccins, médicaments, qui sont censés être utilisés dans l'espace de l'Union européenne. Si un produit n'est pas approuvé par l'Agence européenne de médicaments, ça ne veut pas dire que ce produit-là est un produit inférieur, parce que ça dépend de la stratégie marketing que puisse être adoptée par un fabricant quelconque. Alors, la Commission de l'Union européenne a été très claire. Effectivement, comme l'a dit la directrice régionale, c'est bien sûr d'approuver le vaccin qui sont approuvés par l'Agence européenne de médicaments, mais également, elle est très claire en disant que les autres vaccins qui ont reçu l'autorisation d'utilisation en urgence émise par l'OMS peuvent être également approuvés par les pays membres de l'Union européenne. Et à ce jour, les informations que nous avons montrent que déjà, beaucoup de pays en Europe ont commencé déjà à autoriser ce vaccin, le Covishield. Nous avons 8 pays, l'Allemagne, l'Espagne, la Grèce, bien récemment la Belgique, la Finlande. Donc, il y a beaucoup de pays qui, les autorités nationales de réglementation, ont suivi la recommandation de la Commission européenne pour approuver ce vaccin. Donc, pour mes résumés, je dirais que, et là, c'est bien dit, Dr Moeti, il s'agit du même produit, tout simplement, qui est produit sur différents sites. Et ça, vous devez nous aider à faire passer ce message pour que les gens ne pensent pas que c'est un vaccin inférieur par rapport à ce qui est utilisé ailleurs. Merci beaucoup.
Merci, Dr. Mihigo. Thank you very much, Dr. Mihigo. We are coming to an end of this virtual press conference. I would like to now turn to our 3 panelists and hear any final messages. Please, you have 1 minute each to wrap up and give us your final message. Thank you. I will start maybe with Dr. Moeti.
Yes, thank you very much. First, I'd like to thank the Honorable Minister very much for having joined us today. I'd also like to thank Dr. Ismail. Thank you so much for having shared with us the challenges and the work that is being done in your countries to respond to this 3rd wave. I'd like to thank our journalist colleagues, as usual, for having joined us, and thank you for the work that you are doing to spread information to the population, to decision makers about the situation in Africa. I can only end by saying, indeed, we are going through, as a continent, a very difficult time at the moment. Not only the 3rd wave, but also the pause that was necessitated in our vaccination programs by the challenges in accessing vaccine supplies. But we are seeing that in the next few weeks, the situation is about to turn around. And I'd like to encourage 2 things. First, again, at the individual level, at the family level, please continue with the prevention measures, because the vaccines are going to help to stop severe illness, but they don't stop the transmission of the virus. And we must do our part to slow down, reduce the transmission of the virus. And one of the things that we can do is to carry out the wearing of masks, not gathering in closed spaces especially, and continue the hygiene measures of washing our hands and avoiding contamination that way. And then secondly, believe that your governments would never ask you to come and be vaccinated with an inferior product, with a product that will harm your health. The side effects are very rare. It is very urgent for each and every one of us who gets the opportunity to come and be vaccinated. I'd like to end there by thanking again all our people on the continent for having put up with a very difficult situation, very difficult economic impact, impact on household incomes, very severe. And we thank you for your patience, and let's continue to do our best at each of our individual levels to overcome this virus. Thank you.
Thank you, Dr. Moeti, for these encouraging words. Monsieur le ministre, est-ce que vous pouvez nous donner votre mot de la fin?
Merci beaucoup, Dr. Moeti. Merci beaucoup à tous les participants. Je pense que c'était une réunion capitale. Ça permet encore, comme vient de le résumer Dr. Moeti, qu'il faudrait que l'Afrique aille de l'avant pour lutter efficacement contre la circulation de ce virus, en matraquant sur la nécessité du respect des gestes barrières et également d'accentuer la communication et la vulgarisation de la vaccination qui nous permettra d'atteindre l'immunité collective. En ce qui concerne la République démocratique du Congo, nous allons multiplier ces efforts parce que c'est important. Il s'agit des millions d'habitants pour le pays et il faut absolument que ce virus cesse de circuler, d'être plus efficace quant aux variants Delta. Je suis vraiment heureux d'avoir participé à cette réunion. Je vous remercie.
Merci, Monsieur le ministre. Dr. Ismail.
Okay. From our side, we would like to thank WHO for the continuous support. We would also like to appeal to the global community to stand for the African continent in the fight against COVID. COVID is actually an uninvited guest, and it, as it actually came out, it has actually gone through pandemic proportions. No country has actually produced it, but also no country was given a choice to get it. We found ourselves in this situation. Initially, when the pandemic started, we thought that we are going to go unscathed. Yes, we realized that this is a big problem coming, big trouble coming to us. And the only thing what we were actually hoping at that time when this pandemic started was actually that we realized that we don't have the means to fight this condition on the scale which most of the European countries were actually doing. And we saw that even their systems were actually crumbling. So we did prepare ourselves for this pandemic, but now obviously with the presence, the emergence of the Delta variant, which has really gone through many places and literally crumbled many systems, we unfortunately also have finally also had the results of these Delta variants, and we are doing our utmost best to also control this year, obviously using the general rules of actually making sure that our people adhere to these general rules which have actually been outlined, but also as a matter of fact, knowing that the vaccine will actually be on the longer run, the only measure to end this pandemic. And that is the reason why we are actually appealing to the international community to really assist us to get more vaccines so that we can also get an end to this year, and so that we can also finally also get a normalization of our lives. We are actually watching the European countries with envy of how they are washing their European cups. And we also think people in Africa deserve the same type of freedoms as well. So please help us as well so that we can help our people. Thank you.
Thank you very much, Dr. Kachetai. Ladies and gentlemen of the press, our panelists, distinguished panelists, this is the end of this press conference. We wish you a very nice day and stay safe. Merci beaucoup à tous de nous avoir rejoints pour cette conférence de presse. C'est la fin et protégez-vous, restez en bonne santé. Merci. Bye bye.
Bye bye.